If you've ever had an injury, you've probably heard the standard advice. Use ice for the first 48 hours, then switch to heat. It's a simple rule, and for a sprained ankle or a pulled muscle, it can work pretty well. But what if your pain isn't new? What if you've been hurting for months or even years? What if you have a condition like chronic pain where the cause of your pain is entirely different? Today, we're going to talk about one of the most common questions I get as a pain scientist. Should I use heat or ice for my chronic pain? And I'm going to tell you why the traditional advice you may have heard may be fundamentally wrong for those with chronic pain. So the most important thing to understand is that the rules for acute pain or new pain are not the same as the rules for chronic pain. Acute pain is your body's alarm system responding to a new injury, a cut, a sprain, a burn. The goal of treatment is to manage the inflammation and protect the injured tissue while it heals. And so that's when the classic PRICE principle comes in. Protect, rest, ice, compress, elevate. But chronic pain is different. As we've talked about in other videos, chronic pain is usually not about ongoing tissue damage. Instead, it's a sensitized nervous system, a faulty alarm that's stuck in the on position. So our goal with heat and ice is different. It's not just about managing inflammation and healing. It's about calming the nervous system, improving function, and helping you get back to doing what you want to do. So let's start with heat. You can think of heat as your tool for stiffness, tension, and general achiness. If your muscles feel tight and sore after a long day, heat is often your best friend. If you wake up in the morning with stiffness in your back or muscles or joints, heat can help you alleviate these stiff areas. Heat can work by increasing blood flow to the specific area or the general area, and this is called vasodilation. That increased blood flow brings more oxygen and nutrients to these tissues, which can help them relax and become more flexible. For many people with chronic pain, neck tension, or widespread muscle soreness from fibromyalgia, a heating pad or a warm bath can feel incredibly soothing. But here's the key. By understanding how heat works, you can use it as an active tool instead of just a passive comfort measure. You can get better long-term results and use it as part of your toolkit. Instead of just using it reactively, you can use it purposefully. So let's give you an example. If you know you're going to be doing something that usually causes stiffness, like gardening or going for a walk, you can apply heat for 10 to 15 minutes beforehand. And this can help you warm up the muscles along with some gentle movements and make activities feel easier. You can also experiment to see whether you prefer moist or dry heat. Some people love the feeling of moist heat from a warm bath or a damp towel. Others prefer the convenience of a dry heating pad. And there's no right or wrong answer. It's just simply what feels best to your body. And a very important safety note, you never want to use heat or ice for that matter on an area where you have any sort of decreased sensation. If you can't feel the temperature properly, you are at risk for burns. And always place a layer of cloth between the heating pad and your skin. So let's talk about ice now. Ice or cold therapy does almost the opposite of heat. It causes vasoconstriction. It narrows the blood vessels, and this can reduce blood flow, which can help decrease inflammation and swelling. So this has a numbing effect, which can provide some temporary pain relief. But when do we use it for chronic pain? The most common scenario is when you have an acute flare-up on top of your chronic pain. So just because you have fibromyalgia doesn't mean you can't also sprain your ankle. You can have a new specific injury with swelling, or if you've overdone it in a specific activity or a particular joint is warm and puffy, ice can be very helpful. For a new injury, you can use ice for about 10 minutes every hour for the first day or so. Then you want to move to decreasing the frequency. A simple bag of frozen peas over a damp towel is my personal favorite, as it molds perfectly to bumpy joints like your knee or your shoulder. However, it's also important to remember that for many people with chronic pain, especially fibromyalgia, ice might not feel good at all. And that brings us to a crucial point. And again, this is the part of the conversation that's often missed with the standard heat versus ice advice. If you do have chronic pain or fibromyalgia, your nervous system is sensitized. This means that your brain can interpret normal sensations like touch, pressure, or temperature as threatening and therefore painful. And this can be a phenomenon called allodynia. For many of my patients with fibromyalgia, the intense cold of an ice pack is perceived by their nervous system as a threat, and it can actually cause their pain to increase. They may experience a burning sensation or a deep aching pain in response to cold. So if this is you, please know that it's not unusual or abnormal. It's simply your physiological response to a sensitized nervous system. So here's the most important rule of all. Listen to your body. If ice makes your pain worse, don't feel you need to use it. It doesn't matter what the general rules say. Your body's response is the only data that matters. For many people living with chronic pain or fibromyalgia, Heat will almost always be more soothing and a calming option because it can send a signal of safety and relaxation to the nervous system. So once you're past the acute stage of a flare-up, some people can often find contrast therapy helpful. So this involves alternating between heat and cold. For example, 1 minute of heat followed by 1 minute of cold, and then repeated several times. The theory is that this can create a kind of pumping action in the blood vessels, which can help reduce swelling and promote healing. This is something you can experiment with. But again, if the cold or the heat phase makes your pain worse, it may not be the right tool for you. So where do you want to put the heater ice? You can use heater ice on very specific areas. If you have a particular trigger point in your shoulder that's causing tension, a small targeted application of heat can be very effective. Similarly, if a specific joint is inflamed, a small ice pack can provide relief without affecting your whole body. So how do you put this all together? I want you to experiment and observe. Create a simple log. When you use heat, how does it feel? When you use ice, what's your body's response? Does heat before activity help? Does ice after activity make things better or worse? You can keep track of what you used, when you used it, and how it felt. And as always, the goal here is not to find a magic cure. The goal here is to add heat and ice to your personal toolbox. Heat and ice are two of the most accessible, affordable, and effective tools you have. So by learning to use them effectively and in tune with your own body, you're taking back a piece of control. It helps you become more active manager in managing your chronic pain so you can do more of what you want to do. If you found this guide helpful, please subscribe for more practical, evidence-based tools. Thank you for watching, and we'll see you in the next one.